Good morning, everybody. I'm just going to do a quick sound check and hope that the comms team are going to let me know that you can hear me all right. My name's Liz Darlison. For those of you that haven't met me, I'm Head of Services at Mesothelioma UK, and I'm also a consultant nurse at the University Hospitals of Leicester. We thought at the charity during these difficult times it might be really useful if we provided a live chat session. And we're hoping to get some other mesothelioma experts available to us over the coming weeks and months to afford people the option to send in questions and then log in live so that some of your mesothelioma specific questions and concerns can be answered in real time, and just really to keep you connected. So please do send your messages in and your questions in. They will be sent to me. If you see me keep flicking over, it's because I do need to keep a check on the live feed as it comes in. So please do send your questions in while we're on air. We're going to be on air for about 15 minutes. We've had a number of questions already sent in to us that I'm going to try and get through. But I think suffice to say that this is difficult times for all of us. And for anybody with another health problem, particularly something like cancer, and even within cancer, something like mesothelioma, the challenges are even harder. And we want to work hard as a charity to keep our mesothelioma community together. And it's also important for us as a charity and the team of nurses that we are still able to reach out to you, that we're still able to be there for you and answer your questions and concerns. And of course, the team of nurses, the charity has 25 nurses now, all working in NHS hospitals and usually able to focus completely on their mesothelioma patients. But unfortunately, at times like this, it's all hands to the pump. And of course, some of those nurses are now going to be called in to help in other areas of the hospital. But we have made a pact that we will work together to ensure, no matter what, there will be one of us available to answer your questions and concerns. And you can get hold of us anytime at all through the free phone helpline number, which is 0800 169 2409, or emailing us at info@mesothelioma.uk.com. So please do share that in your local communities, your local mesothelioma communities, on your own social media, because we will be there to help you and support you as much as we can. And remember, it's important to us, because our work is so important to us and you're important to us, that we keep connected to you and still feel that we're able to help you. So with that, I'm going to start looking at some of the questions that have come in. I'm not going to mention who's sent the questions in, but if you do want us to say who it's from, then please do put that on your emails and your posts so that we know. So what is happening for new patients, and will they get their diagnosis as easy? Well, what I can assure you is that the hospitals are working really hard to ensure those patients most in need, irrespective of the COVID virus, are still going to have their needs addressed. And the healthcare teams working in the diagnosis of mesothelioma patients are still active. Yes, they are helping with their local efforts to prepare for patients, the influx of patients. But as it stands at the moment, it is pretty much business as usual in terms of receiving referrals and helping patients to get the investigations that they need. Now, of course, on an individual basis, there will be a risk versus benefit assessment. And some patients, it may be considered too risky to bring them into the hospital setting or to subject them to some of the more invasive investigations. But generally speaking, those patients that are needing CT scans and chest x-rays and the likes, those are still going ahead. MDT meetings, the weekly meetings, some of those are still going ahead. Some are on limited staff. I know that the MDT that we hold locally, we are now having just 2 members of staff there and are going to be dialing in and using video conferencing. So as much as possible, services will continue. And of course, if anybody has any particular concerns, then please get in touch with your local team or you can always ring the information line at Meso UK. And I would urge people, if you are worried about signs and symptoms or concerns about mesothelioma, then please continue to reach out as you would, irrespective of the COVID crisis that we're currently dealing with. Of course, if you have any signs and symptoms of the virus, then that's a different matter, and we would urge you then to contact 111 and ask their advice about pursuing clinical advice, clinical face-to-face treatment. Another question that's come in: do you expect all mesothelioma patients to be on the 1.5 million list of people to self-isolate for 12 weeks? If we don't receive a letter, who do we contact to find out? So if you go on to the .gov site, it doesn't explicitly say mesothelioma patients. In fact, it says on there, it does talk about lung cancer patients. It talks about cancer patients on chemotherapy, and it also talks about lung cancer patients receiving radical radiotherapy. So it doesn't explicitly say mesothelioma patients, but we've been asking a number of experts, oncology experts, and the bottom line is yes, then you should consider that you should be shielded. So you should take all the precautions that the government have circulated this week, and you should shield yourself from any unnecessary contact or exposure. In terms of getting yourself put on that list, and I think clearly the benefits of being on that list is that there are extra levels of help and support for you in terms of help with provisions and having somebody who can advocate for you outside of the home. So if you feel you need to be on that list, I would urge you on the government site again, and if you're not internet savvy, you'll probably have to get somebody to help you with this, and that can be done remotely, so it can be done over the phone with you giving instructions over the phone to somebody. So there is an online register, so I would urge you to try and register online. And I also understand that GP surgeries can add somebody to that at-risk register. So bottom line is yes, anybody with a mesothelioma diagnosis, it is advised that you take all the shielding precautions that have been circulated this week. I've had one question come in from a lady whose father has mesothelioma, and she lives near her dad, but she's providing quite a lot of care and support, and she is asking whether or not you should follow the shielding advice when somebody has these care needs and is also elderly and frail, living with a terminal cancer, as a daughter, what is her role in all of that? And all I can say is it is really, really difficult, particularly with somebody who is living with a life-limiting disease like mesothelioma. And the government website basically says that in those circumstances, then it's your call, really, how far you take these precautions. What we would advise is that you can still uphold a lot of the shielding advice and still having some degree of contact. So for instance, I would really upscale the washing of door handles, trying to avoid using any cutlery, cups, anything in the house, having a no-touch approach if you do need to go into the home. And also I've heard of other people who have been sitting out in the garden and just having contact that way. So as much as possible, please follow the shielding advice, but I think you have to look at your own personal circumstances and consider how far you need to take it. And if you would really like the support on a one-to-one basis to just talk that through with somebody in an informed way, then please just pick up the phone to the information line. One of the nurses will be glad to have a chat through with you about the steps that you can take. We've had another call from somebody who has recently been accepted to start on the confirmed study and is due to start treatment this week and is wondering if that treatment will go ahead. As far as I'm aware, so confirmed study is now closed anyway, but there will be a few patients that will be caught in this situation where they've been accepted onto the trial but haven't quite started treatment. As far as I'm aware, those treatments are likely to, or possibly will still go ahead. But on an individual basis, there will be a risk versus benefit. Again, I've spoken to oncologists this morning about the impact of immunotherapy on the risk of COVID virus. And I think there's a lot of unknowns. Many of you will know that immunotherapy is a new treatment, a relatively new treatment in cancer care. And so there are more unknowns probably with immunotherapy. And we're not really sure what the impact of being on immunotherapy is in terms of your susceptibility to the COVID virus. So for that reason, it'll be on an individual basis. And if you are a younger patient with less health problems, then it is more likely that your treatment will go ahead. If, however, you have other health problems and are elderly, then it is likely that they will be looking at the risk benefit. But this is a really fast changing situation, as we all know, and so don't think that a decision that is made today or this week will stand for the duration that we are in this crisis. And please keep in touch with your local teams. A lot of all your clinic appointments and so on are going to be by telephone call now, but the situation may change. So forgive me, I'm just going to switch over now to another list of questions. I think I've answered most of those on that sheet. So should I attend for my routine scan? So the official line on that is yes. Currently, routine disease surveillance CT scanning is going ahead. The advice is to not linger in the hospital anywhere, go straight to the CT department and leave immediately afterwards. And of course, remember hand hygiene throughout all of that. I've had some conversations with patients that have been living with their mesothelioma a number of months and years even, and who have been having 3 monthly CT scans and have said that they've done their own risk benefit and they're going to skip this next scan. And again, I think on an individual basis, have that discussion with your healthcare team, or give one of the Meso UK, have a chat with one of the Meso UK nurses through the information line if you decide you want to perhaps prolong the interval between your scan, or indeed skip a scan, because in some situations that may be acceptable. But otherwise, the bottom line generally is yes, but please go get dropped off at the door. Do not take anybody else in with you to the hospital. Go straight for your scan and straight away again leave. And your results will now be by telephone. And so the clinics, I'm sure, will still be going ahead, but they will be contacting you by phone. So it might be a good idea just to make sure that your hospital team do have your up-to-date telephone numbers. Oh my goodness, you're going to have to forgive me. My dog is going to scratch the door down to get in. I'm back. Forgive me. Another question. If someone like me with my medical history contracts this, are they likely to treat me? And I think, again, with yes, is what I'm going to say is yes, of course. If you unfortunately find yourself so acutely unwell with the COVID virus and you end up having to go into hospital, the healthcare team there are going to do everything they can to support you. The bottom line is we don't have an ABC of proven treatments for this virus. And so on each individual case, it's going to be a risk versus benefit. And I can't say more than that. All I can say is that I'm based in a large teaching hospital. I have seen the enormous effort to prepare for the surge in patients to come, and to try and make sure that healthcare teams are not put in a situation where they're going to have to make those really difficult decisions. So if you do find yourself having to need treatment in hospital, then another question we've been asked is, should I let my mesothelioma team know? Yes, please do, because if they can, it's likely that they would obviously like to come and check on you and just see if they can add anything to your treatment pathway. I am sorry about this. I would also say that please don't think that it isn't worth seeking help if you do end up showing signs and symptoms of the COVID virus, because healthcare teams are going to do all they can to continue to maintain treatment for everybody. So there's a couple of general things I just wanted to say before I sign off. We really want to keep the mesothelioma community active and connected. So please do share as wide and as far as you possibly can Mesothelioma UK sites, and encourage people to connect, encourage people to learn how to use IT so that they can connect, and keep an eye on our posts. We're going to be doing more live chats like this, hopefully not all with me. I'm hoping we can get some other experts freed up from their clinical responsibilities to come online as well. We're also going to be having some exercise videos posted on our Facebook sites. Julie Roberts, a lady from Scotland, is going to be helping us with that, and we really want you to do all you can to keep yourself as fit and as active as you possibly can during this period of shielding and isolation, because once we get through this crisis, it's hopefully going to be back to business as usual. And you know, and I know, fitness is absolutely crucial when you're looking to keep your treatment options as wide and as broad as possible. So please do all that you can. You go up and down them stairs as many times as you can, and around your house, exercise as much as you can. If you've got an exercise bike or any old gym equipment, now's the time to dust it down and to keep yourself as fit and active as you can. And do all you can to help with the mental effects of being isolated. So keep connected, keep on the phone. Don't ever feel like you're bothering anybody. You pick up the phone and you chat away, and try and get some social Facebook groups going or messenger chat groups going so that you feel connected. If you're not somebody who used to listen to the radio, now's the time to switch it on. You don't have to listen to the news or the chat shows. Even, just feel connected to the outside world. We as a charity, we need your help more than ever. Obviously our income is going to suffer through all of this, and that we're going to have all sorts of ideas for virtual fundraising events that we're going to be posting. So please, if you feel able to, we really do want you to continue to support us, and please, as I said, be assured that the Meso UK team and the Meso UK nurses, we are here if you need us. Don't ever be worried about picking up the phone to us. If we can't help you, we'll do all we can to signpost you to someone that can help you. So with that, I'm going to sign off. Sorry about the interruptions and my little doggy joining us. But thank you for giving me a reason to put some makeup on today. I've got my Meso UK t-shirt on, but I've got my slippers on and my leggings underneath here. So it's been good to blow dry my hair this morning and put my lippy on. And stay well, all of you. Please follow the shielding guidelines as stringently as you possibly can, and stay well. Bye-bye.